all-payer claims databases.
Thanks, Cari. So an all-payer claims database is essentially a large database that includes different kinds of healthcare claim information, from medical, dental, and pharmacy claims. The Colorado All-Payer Claims Database collects from both public and private payers. And there are some distinct advantages over a single payer or population-based database. And that includes the ability to capture longitudinal care on individuals so that we can capture churn among different plans over years. We get an insight into patient data that spans care settings. We get information from most or almost most insurance companies in the state, which gives us an ability to start looking at what care looks like and what utilization looks like from one kind of coverage to another. We also get demographic, diagnostic, excuse me, procedural and reimbursement information, including total charges, the plan paid or that negotiated amount, and the patient responsibility. And so we're able to get insight into what those large charge master costs are, as well as what gets negotiated by the payer. This information can be used for policy, research, clinical and health system quality performance, program evaluation, project health management, and a whole lot of other options. And we're going to talk a little bit later about how some of our change agents are putting that data to work. So currently 18 states have some kind of an APCD in place. Cari, could you go to the next slide for me? So this is a map of sort of where we have either interest or activity in various states. I will say this map is kind of a little bit, I think it's a year or so back, because we have had a lot of activity in this last year. And there are a number of states that are currently in those lighter colors that are in the middle of implementing an APCD. Next slide. So a Commonwealth report that came out last year actually looked at the growing role of all-payer claims databases and what kinds of functions that they can actually execute. And that report identified 6 critical functions of an APCD, and that includes reporting on healthcare spending and utilization, enhancing policy and regulatory analysis, informing the public about healthcare prices and policy, providing reliable data for healthcare research, supporting public health monitoring, and enabling value-based purchasing and healthcare improvement. The Commonwealth report identified CIVHC and the Colorado APCD as one of only 2 APCDs in the country who actually fulfills all 6 critical functions of an APCD. The other was the APCD in Maine, who is a close partner of CIVHC. Next slide. This is a very brief and condensed history of the Colorado APCD. In 2008 was the commission recommendation to develop an APCD for Colorado. And as you can see, we've had legislative support and support from the state at every step along the way. And we now have great support from our legislators, from our state partners, and from our change agents across the state and nation. Next slide. Cari.
So what's in the APCD? So this data covers 2013 through 2021. So in that time span, we have over 870 million claims. We're fast approaching the billion mark. And if you count all of the claims that we started collecting back in 2009, we probably have surpassed that number, but we really think of our 2012 data and on as kind of the most rich. That's when we had the most payers and the highest data quality. We currently have 36 commercial payers that are submitting. That's as of that snapshot of 2021. And we do get Medicaid and Medicare, both fee-for-service and Advantage. We have, in 2021, we had over 5 million unique lives. And that includes 1 million, or about half of the self-insured. And those of you who are unfamiliar, there's a Supreme Court ruling that does not allow states to mandate ERISA-based self-insured, but we still collect those on a voluntary basis, which we have a handful of the ERISA-based self-insured, and then the non-ERISA-based self-insured do still have to submit to the all-payer claims database. We have nearly 70% of covered lives. If you look at medical only, if we had a benchmark, there really isn't a benchmark out there for us to compare across all types of medical, pharmacy, and dental. So we have more than that if you look at beyond medical, but we estimate we have over 70% of the covered lives in Colorado. And again, we have trend information from 2013 to present. So we always show this slide, and then the next question is, okay, that's great, but what's not in the APCD? So we have that for you too. We do not have federal programs. We can't collect from those federal programs as of yet, although we are working closely with the VA and have some special projects in place. So that may change here soon. We don't collect TRICARE or Indian Health Services claims. Again, the majority of those ERISA-based self-insured employers we do not have, although we're collecting probably 25% of those. We don't have anything coming in if you are uninsured or if you pay out of pocket. So no self-pay claims or uninsured claims. And the supplemental information that we have is coming in, but is probably incomplete. So what does get submitted on a monthly basis, and this is different in all states. So we are excited to be able to get not only medical claims, the professional claims, pharmacy claims, eligibility files, but we also get dental claims. And I don't know that all states are collecting that. And pretty soon we'll be collecting vision claims as well. We have some of those coming in now, but those are going to be those are now in the data submission guide. We also have non-claims data, and this is another thing that sets the Colorado apart. Not all APCDs collect non-claims based data, and on an annual basis, we collect alternative payment model information from the payers. We collect prescription drug rebate information, and then coming up as in a new change to our data submission guide is value-based pharmaceutical contracts that will be coming in later this year, and new data to support the prescription drug affordability bill. And we'll be talking a little bit more about some of those here soon. So what does all this information tell us? It tells us who received care and why. So we have a member composite ID that tracks patients. So we can, as Kristin said, that one of the values is no matter what kind of insurance you've had from 2013 on, unless you were uninsured, we would have gaps in information, but we could track if you went from Medicare to commercial and then back. We can track that over time and across years and payers. We can get basic demographic information. We have age and gender and 3-digit zip codes. We understand why you went for a particular visit. So we get the diagnostic information and procedure codes at the claim line level. We also know who provided care for patients and where. So we have also a provider composite ID that tracks providers across facilities. We have the NPI level provider information. So we do collect that information as well as where the provider's 5-digit zip code information is there. And then provider specialty and subspecialty is also collected. And then we know which insurance company paid for the care, and we get that payer code and line of business information. We also know how much was paid, and this is unique for an APCD too. Not all APCDs actually collect the allowed amount. So we get not only the charge, how much was charged, but also the allowed amount, which is what was actually paid. And so that paid amount is really valuable, is not just saying, okay, this was what charged, but what was charged, but this was the actual payment. And then we get the the patient costs as well. So in the form of copay, coinsurance, and deductibles, we will be getting the deductible and premium information that's new as of 2022, new to the DSG change. And then we get the coordination of benefits information as well, the amount and the COB flag. And then we also know information about medications, where the medications that you got filled, the pharmacy ID, we get the drug name, the dosage, and the number of days prescribed, and the date filled as well. So a vast amount of information that we collect. And then obviously there are some very key values to the APCD too, which I'm going to turn over to Kristin.
Thanks, Cari. So the Colorado APCD has a number of unique features that make it as usable as it is. We have spent a lot of time and resources over the last couple of years really doubling down on our data intake and quality processes to ensure that we have uniform data across years and completeness across the payers, and that we've got really clear insight when there are some of those variations between payers or where we have some issues where data needs to have special considerations. We collect patient data that spans all care settings. So we get inpatient, outpatient, ambulatory surgery centers, skilled nursing facilities, and all other sorts of locations of care. As Cari and I both mentioned, we capture that longitudinal care information on individuals. This is actually not a universal characteristic of an APCD. So being able to track an individual across plan types, and because we do have that member ID, which is a de-identified sort of pseudonym for a member, we can do that in a completely de-identified fashion. So even without any identifiers, we're able to track individuals across geographies as they move across the state, across plan types, product types, and insurance types. We get demographic, diagnostic, procedural, and reimbursement information for approximately 8.6 million unique lives over the course of the full APCD. So Cari mentioned earlier that we have over 5 million unique lives for 2021. If you look at the total number of unique lives from 2012 through current, we have over 8.6 million individuals who have had some interaction with the Colorado insurance system over that time. And we also have capabilities that allow us to evaluate the impact of certain socioeconomic and racial factors on health equity. This is another area where we have put a lot of focus over the last few years to really build out our capabilities. And we have a number of really great next steps identified for the coming years as well to really help us with robust reporting around health equity and how we can help address that. Next page. So some other unique aspects of the Colorado APCD, we do have some value-added data processing. So this is things that we add to the data once it's come in from the payers. These are not things that are submitted by the payers, but rather how we process the data for increased utilization. And that includes the creation of a master patient index, which is a unique person ID. This is what allows us to create an accurate member ID to track individuals across years. We also have a master provider index, which gives us the ability to roll up reporting at the provider level and see what kind of services a provider is giving over the course of years or plans. We create some value-added analytics. We run the low-value care data and the Medicare price comparisons. Both of those pieces add a lot of insight into the data, giving us an idea of where are we seeing a lot of care that isn't actually benefiting Coloradans? And then how are we seeing prices vary around that Medicare standard? Both of those pieces of analytics are in partnership with Milliman. And then we also have geocoded the APCD. And we were in the first wave of APCDs to actually geocode that data so that we're allowed, or so that we can connect it with census tract data from the US Census to give us insight into some of those social determinants of health and the impact of race and ethnicity across our analytics. And then we also have very timely claims data submission. We do receive submissions monthly from our payers, and then every other month we process all of those submissions into our data warehouse. And typically our data reflects care paid for the 3 months prior. So our data is usually 3 months behind. There's a 3-month lag. There we go. Most APCDs have got a 6 to 12-month lag. And then specifically, we want to make sure that we're calling out the value that CIVHC itself as a nonprofit brings to the Colorado APCD. As Cari mentioned earlier, we are nonpartisan, and we do serve all change agents across the state and many across the country. We're a nonprofit, which means that we have the ability to seek and join grants with some of our major partners across the country. I know some of you on the webinar today have been with us on a grant, and that's a capability that we bring to this. The number and breadth of annual public and non-public report releases. CIVHC has orders of magnitude more releases than any other APCD in the country. And that's a huge testament to the work that our staff does. We have an expansive data quality program with, I believe, we're up to 7 dedicated data quality analysts who do nothing but focus on that work. And then we are a collaborator and a partner with many change agents to make sure that we can help drive increased visibility into this data and to encourage other states to be doing the same thing. We connect closely with Colorado community groups. We provide data and insights to advance health across the state for all kinds of individuals. And then CIVHC itself leads some programs that focus on aging and end-of-life care. This has been a programmatic focus for CIVHC from the very beginning. We do believe that this is a critical piece of care that is not getting enough attention, and we want to make sure that we're shining a light on these very important topics. Next slide. So finally, if you want to learn more information about the details, the nitty-gritty of what is in the Colorado APCD, get some numbers by payer, by year, just kind of seeing, the diversity of things that we do have access to. We've created an insights dashboard, and you can sort of see the trail to follow to get to that dashboard. It's an enormously valuable resource. We have researchers who use this all the time to determine whether or not our data will be suitable for their research projects, but it's a really great way to get an idea of what we have the ability to talk about and to analyze. And I'm going to hand it over to Cari to talk about what happened in the APCD then and where are we now.
Thanks, Kristin. So I have to give Stephanie, my fabulous coworker, some credit for pulling all of these together for our 10-year anniversary celebration. We've been rolling them out on a monthly basis, but it's been really fun to see how far we've come. So number of payers, we went from 9, the very first release that we did. And when we launched the APCD, we only had 8 commercial payers and Medicaid. Now, as we mentioned, we have all of those fabulous commercial payers. We have Medicaid and collecting Medicare fee-for-service and the Medicare Advantage through the commercial plans. We have a lot more robustness in terms of the types of claims. We started out with just medical and pharmacy. Now we have the medical pharmacy, we added the dental, collecting those drug rebates and alternative payment models, and soon to come more on the non-claim side. We went from needing a terabyte of data to store the APCD. Now it's 13 terabytes. And to give you a little perspective, 64 gigabytes is a smartphone. So all this is still way over my head, but it's a lot. It takes a lot to store the APCD. We went from just having one interactive public report to now we're producing over 35 public reports, including interactive reports, downloadable data sets, infographics, you name it, issue briefs. We have a ton of stuff. If you haven't checked out our website, please go on there and let us know what you think, and see if you're looking for something, please reach out. We went from our Shop for Care tool, which is our consumer focused tool. If you haven't seen that, it's right on the top tab of our website. It says Shop for Care. We had, when we launched it in 2014, only 4 actual procedures that we provided on that Shop for Care tool, because it was a lot to pull together the first time. Now we have over 22 procedures that are actually episode based, and we're one of the only APCDs in the nation to provide episode based. So that means you're all in price, whether, and including your pre-op, your actual surgery, and post-op. That's all in across any type of provider that you might see. And then we also have 30 imaging procedures. And so we're excited to be able to provide more and more services on that Shop for Care tool. Non-public releases, we went from 9 in 2012 to now we're averaging over 120, 140. When we created this was from fiscal year 2021, and Kristin will give you some updates on our 2022, fiscal year 2022 numbers, but we're very proud of the non-public releases that we are able to do. And as Kristin said, it's a huge lift, huge kudos to all of our analytic team and our data warehouse managers, HSRI, who they do an incredible job with that too, to help us. We went from no APCD legislation in 2012 in terms of like being written into legislation. Obviously, we have the APCD legislation itself, but in 2022 now we are written into over 9, I believe, if I count those up, different bills to either implement or report or support implementation of a bill. So we have the primary, I'll spend a little bit of time on here on this because we aren't going to talk about as much of the legislative side of things. But it's been very exciting to see the APCD being used for some critical legislation that's improving healthcare. So investing in primary care to reduce healthcare costs, we provide an annual file that supports the primary care collaborative that's looking at primary care reimbursement and how do we enhance primary care access for Coloradans. We support the out-of-network bill as well, which is more of a surprise billing, if you've heard that term. So helping to figure out what should those payments be if you do go to an out-of-network provider. So in the past, it's been, they can charge you anything that they want to. And now the APCD is used to set reasonable prices that they can bill patients. We're also supporting the Colorado Prescription Drug Affordability Board, and more data will be coming for that through the drug rebate information and new stuff that we're collecting this year. Also supporting the Colorado Option Plan, and then also coverage requirements for healthcare products. There's a new tool that will be coming out this year that's going to be a public tool to view claims reimbursement at the CPT level and the HCPCS code level across different regions of Colorado. So that will be a new tool that's going to be launched in January. We also support the primary care alternative payment models work, and that is new data that we will be providing on top of the APM data that we provide through the primary care bill. We also will be doing some work to understand the actual outcomes. So looking at quality information around APMs and how that's enhancing outcomes and quality. There's also a new bill that allows a review of new legislation on an annual basis, and the APCD can be used to support that through data sets that we provide. And then we'll also be supporting the Behavioral Health Administration with information from the Colorado APCD that can inform mental health, behavioral health, and all of the great work that the BHA is going to be doing. That's just getting up and running, and we're excited to be able to support those efforts. And I'm